Almost 200,000 people have died from COVID-19 in the United States. No country has been hit as hard as the U.S., and no country has politicized the pandemic like America either. With no vaccine and no cure for COVID-19, face masks provide the most effective protection. And yet, President Trump refuses to wear one, rejecting the advice from doctors and scientists. Listen to what the head of the Centers for Disease Control told a congressional committee on Wednesday.
I'm not going to comment directly about the president, but I am going to comment as the CDC director that face masks, these face masks, are the most important, powerful public health tool we have. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will.
Now, that is the head of the CDC, arguably the world's most respected infectious disease prevention center. He is speaking with the force of facts and science, but that is easily overpowered by the politics of protest in the U.S. Consider Florida. Nearly 13,000 people have died there from the virus. Despite evidence that masks prevent infection and can even prevent death, some people in Florida are adamant anti-maskers. I want you to take a look at what happened this week inside a Target store in Fort Lauderdale.
It's all about choice. Yeah, take it off. You don't need it.
What you're looking at is a flash mob of anti-maskers walking through the store telling customers to take their masks off. The startled shoppers you see now, they're wearing their masks. They are protected, we hope. But the protesters shouting loudly in a non-socially distanced group, they are making themselves prime targets for the virus. They know that, but they don't believe it. Here in Berlin, we have also seen demonstrations of anti-maskers, but on this side of the Atlantic, the virus itself remains threat number one, and that threat is again acute. The number of new coronavirus cases in Europe is surging. Every country reporting spikes in new infections. Some, such as France, reporting more daily cases now than they did at the peak back in April. The UK, one of Europe's hardest hit countries, imposed stricter social restrictions last week, and Spain is expected to announce new targeted lockdown measures for Madrid on Friday. Madrid accounts for 1/3 of all coronavirus cases in Spain, and the country is registering several thousand new infections every day. And even here in Germany, where infections and deaths have remained relatively low, we are seeing a sizable jump in new cases. All of this has the World Health Organization worried and sounding the alarm.
In the spring and early summer, we were able to see the impact of strict lockdown measures. Our efforts, our sacrifices paid off. In June, cases hit an all-time low. The September case numbers, however, should serve as a wake-up call for all of us.
All right, I'm going to bring in now my colleague Pablo Elias here at the big table. Pablo, I mean, this is deja vu for us, but for the people in Madrid. Why is Madrid in this situation yet again?
Well, first and foremost, it comes down to a lack of preparation with regards to what's happening now in the medical system. There's a lack of staff. While they're more prepared in the sense that they have all the masks and all those sort of things that they didn't have back in March and April, now they have a problem with staff numbers. So often it's very difficult for people to actually even get a test done because a lot of the medical centres, so the primary care facilities, are just not able to cope at the moment.
A lot of the nurses died from COVID-19,
Well, this
right?
is it. There are a lot, and they're also having a problem in that they just haven't hired enough staff. They weren't prepared for it. And one big issue that was being discussed a lot over the summer was the lack of contact tracing. People working in that area in Madrid, and it was heavily criticised of the regional government. So this combination of issues has led the capital to the situation that we find ourselves in.
And how bad are the numbers?
The numbers are not good. You mentioned a few of them there, but actually with regards to the tests, almost 1 in 4 of the tests coming back are positive in Madrid. Now, that's incredibly high, considering they should be below 5% for a situation to be considered under control. They account for around 1/3 of Spain's total new cases in Madrid. Now, the hospitals are filling up. It's nowhere near the situation it was back in March and April, but it is causing some concern. And even this field hospital, which was quite famous back in the pandemic, the worst of it, is potentially going to be opened up. So there's a lot of concern amongst the residents there.
All right, so the numbers are not good. Who is most affected then by these new infections?
Well, this is the area which is causing, obviously, a lot of controversy. And if you look at the regions or the parts of the city that are most affected, it also happens to be the poorer parts of the city. In fact, the numbers there are off the charts. In some instances, it's over 1,000 cases per 100,000. When you compare that to Germany, which is at 19, you can really see how bad the situation is. And within the city, the richer parts of the city are also around a third of those figures. Why? Because you've got high numbers of people who are unemployed or working in essentially precarious situations. Often they can't take a day off if they're ill, so they also can't get the primary care that they need because the primary care facilities in those areas are just not able to cope.
They can't socially distance,
They can't socially distance because they're living in poor conditions. And so this is the problem. It's a combination of problems there. Also, it's a city that is very well connected. It has a very good commuter system, very good metro trains and buses, so people move around with frequency. So it's highlighting the fact that if you're rich, you won't be as badly affected.
I mean, that's important to remember. And it's also important to remember that, all of Europe is watching Spain right now to see if these targeted local lockdowns will do the job, because no one wants to have a second major lockdown, right?
You're absolutely right, and we've already seen it in certain parts of Spain where some cities have actually had localised lockdowns, but really what they want to avoid is actually a lockdown like the one that we saw back in March and April. It causes a lot of stress and panic among Spaniards. I've lived in Madrid for many years, and I know how people are feeling about that, and I know a lot of these stories firsthand of how difficult it is to get a test done. So, a combination of very worrying factors.
The worst déjà vu, that's for sure. Pablo Elias, Pablo, as always, thank you.
Worldwide coronavirus infections have passed 30 million, that according to the latest figures from Johns Hopkins University. More than 940,000 people have now died of COVID-19. These numbers announced as Israel heads back into a nationwide coronavirus lockdown later on Friday. It's the first country to shut down for a second time. Hundreds protesting the return of the measures in Tel Aviv, saying another lockdown would cause yet more harm to the economy. The 3-week-long restrictions come into effect just hours before the start of the Jewish New Year, Rosh Hashanah. Israeli authorities say the measures are necessary after the infection rate soared back to become one of the highest in the world. Our Jerusalem correspondent, Tanya Kramer, has this report.
Just a few hours before the country goes into its second prolonged lockdown, people in this market here in Jerusalem are rushing to get their shopping done. The lockdown comes at the start of one of the most important holidays, Rosh Hashanah, the Jewish New Year. Starting Friday, Israelis will only be allowed to venture 500 meters from their home. The final list of restrictions and exemptions published on Thursday is long. The new lockdown comes as the country has seen infection rates rise dramatically. The new rules will keep Israelis at home except for going out to cover basic needs, to go out for shopping or to go to work. Schools, malls, sports centers will be shuttered and restaurants will only be allowed to do deliveries. This follows weeks of erratic decision-making by the government. Its handling of the corona crisis has been sharply criticized in recent weeks.
I think it's going to be hard. After one lockdown, I think most people are just kind of tired of it. They see it as mainly political more than a public health issue. And especially now with the holidays, it seems that, just a lot more people are not going to follow the rules.
Everybody is enraged and there's a sense of confusion. I feel it is a mistake. It wasn't well prepared, there was no exit strategy from the last lockdown, and now we enter another cycle of horror. I think it's unnecessary, mostly because there are a lot of loopholes not to keep it. I don't know if my daughter will be allowed to work or my husband. I don't know what's open and what is not. For now, the lockdown is expected to last at least 3 weeks, leaving Israelis worried that the country could be in for an extended lockdown period.
Well, Germany's top virologist has warned that this country could be facing a further rise in new coronavirus cases and see a possible return to tighter restrictions. Christian Drosten regularly briefs the German government and developed the first COVID diagnostic test, which was adopted by the World Health Organization. In recent days, new infections in Germany have risen again to levels not seen since April.
Wear a mask, wash your hands, and maintain distance. People in Germany are accustomed to following these safety and hygiene guidelines. Yet despite this, the rate of infection is climbing, with more than 2,000 new cases in a single day, the highest count since April. Germany's most prominent virologist, Christian Drosten, sees the development critically. He spoke at a conference in Berlin on Thursday and detailed some of his concerns in an interview with Deutsche Welle.
And look at other countries, look at France, the UK, Spain. What we're seeing there is what we will see in Germany if we don't react very early on in a way that needs to be adjusted, that needs to be let's say, bearable for the economy and at the same time targeted. And this is a very difficult task to find the right point of time.
Drosten has praise for Germany's coronavirus policies and the response by the country's leadership to the pandemic. He says Germany has been efficient and measures have softened the pandemic's impact. But he also says the government could do a better job of explaining why certain decisions are made.
It is not sufficient to impose rules that people don't understand. So the cooperation of the population, especially in the coming weeks and months over autumn and winter, is probably one of the most important functions in the whole concept to intervene.
Drosten says from a global perspective, current developments in India are particularly worrying. The virus is spreading there almost uncontrollably. And he says the situation in many Western countries could also become more threatening.
There are areas, including in Europe, where there is little control, where countries already go into autumn with a high background incidence. I believe there are countries, including in Europe, that will have to impose stricter measures very soon.
Drosten, like many others, is hoping a vaccine will soon be available. He sees it as the only clear way out of the global state of crisis.
Let's take a look now at some more developments in the pandemic. The World Health Organization says more than 170 countries have signed up for its global vaccine plan. Countries have until midnight Friday to make legally binding commitments to that program. A number of Latin American nations have asked for an extension. India has reported more than 96,000 new cases of COVID-19 in the last 24 hours. The country's health ministry says that over 1,000 more people had died as the infection rate shows no sign of slowing. And Australia has reported its lowest total of new cases in 3 months. 35 new cases reported on Friday, the bulk of them in the state of Victoria.